Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today I want to come on and discuss ulcerative colitis and its relationship to veterans' disability. So ulcerative colitis is a condition that many veterans suffer from, and it's a form of inflammatory bowel disease. So there's another common form of inflammatory bowel disease called Crohn's disease, which has some overlapping qualities and is also something that many veterans are service connected for. But we're going to talk about that on another video on another day. And today's focus is going to be about ulcerative colitis. So what is ulcerative colitis? So I'm going to pull up the Mayo Clinic's definition, and the definition is that it is an inflammatory bowel disorder, like I mentioned, inflammatory bowel disease that causes inflammation and ulcers or sores in the digestive tract. Ulcerative colitis affects the innermost lining of your large intestines, also called the colon and rectum. And most people's symptoms usually develop over time rather than suddenly. It is usually diagnosed by, people are having blood in their stool and things like that, and they get a colonoscopy or other diagnostic studies, and it's found at that time. Some of the symptoms include diarrhea, blood in the stool, abdominal pain and cramping, weight loss, fatigue, fever. There's a slew of different symptoms that a person can have. So a lot of times people also talk to me about this, and they sort of confuse it with IBS, which is irritable bowel syndrome. That is a different medical condition than inflammatory bowel disease. That is more of a functional gastrointestinal disorder, and this is a more significant, and I hate to say that because IBS can be very significant to some people, but this is causing ulcerations in the colon itself and bleeding and a lot of issues that can be seen on, like I said, colonoscopy and other diagnostic studies, lab tests. You can develop anemia and things like that. So ulcerative colitis, how can people be service connected for ulcerative colitis? So there's a few different ways, right? So either on a primary basis or direct to service basis. If a person developed this condition on active duty or in the line of duty, they can be service connected for it. When I was treating service members on active duty, I actually had a few active duty guys that developed this just randomly in their 20s or 30s, just onset while they were on active duty. And typically those guys were wound up getting med boarded and got separated because of the severity of the condition and the medications that they were on in those specific cases. But those guys, usually if you're diagnosed on active duty and the condition continues and you're suffering from it post-service, that should be something that's fairly straightforward, not always, but that's a primary or direct service connection. On a secondary basis, I often see this related to other medical conditions, especially mental health conditions like PTSD or depression or anxiety due to stress that increases flares and can really lead to exacerbation of the condition. I'm going to do a specific video on PTSD related to ulcerative colitis at a later date. But it's just important to know that it can be related on a secondary basis to other conditions if it's causing or aggravating the condition or worsening it, right? So we talked about primary and secondary. We talked about, some of those symptoms. So I want to go over some of the ratings, right? So I am not an accredited claims agent or VSO or an attorney. I don't represent clients or veterans in the claims process. It's always best to speak with one of those people if you need clarification or help. I do write medical opinions. Like I said, I used to be a C&P examiner, and I write these types of reports for veterans now. They're never required. You can often get one for little to no cost from your treating provider. And that can sometimes be helpful for you in your pursuit of VA disability. So let's talk really quick about some of that rating criteria. And of course, this is always subject to change. So I recommend that you follow up with one of those accredited legal professionals if you have questions on this, right? So it's rated anywhere from 10% to 100%. So at the 10% level, it is a veteran that has moderate ulcerative colitis with infrequent exacerbations. At the 30% level, it's moderately severe ulcerative colitis with frequent exacerbations. 60% is going to be severe ulcerative colitis, meaning that they have several attacks a year. They can also have malnutrition, and their health can be considered only fair during remissions, right? So when they're not having those flares, they're still having some health deficits because of the condition. And then at that 100% level, it's pronounced. Ulcerative colitis, meaning it can cause malnutrition, anemia, again, all that bleeding. If you can develop anemia if you've got a ton of blood in your stool, right, related to it, and serious complications such as, maybe you've got to have surgery or something else. Okay. So I hope this was helpful and you guys have a good understanding of ulcerative colitis and how it can be related to service. Like I said, I'm going to do another video later on with ulcerative colitis as it relates to mental health conditions. I'll also touch on Crohn's at another date and time and do a video on that. So I hope this was helpful, guys. Please drop some comments if you have any questions. And as always, thank you for watching. Please like and subscribe. Thanks.